Your doctor has prescribed medication for you via the Turbuhaler from AstraZeneca. For the best treatment of your symptoms, it is important to use the Turbuhaler properly. It is important that you inhale properly so that after being sprayed into the nasal cavity, the medicine will inhibit the allergic inflammation of the nasal membrane. We will now show you how to use Turbuhaler. Check the use-by date before you start. If the use-by date has expired, return Turbuhaler to your pharmacy. When you open a new pack of Turbuhaler, activate it by turning the grip back and forth twice in one go. 2 clicks should be heard. A small window is located under the Turbuhaler nosepiece. When approximately 20 inhalations remain, a red line will appear behind it. When the red stripe reaches the bottom of the window, Turbuhaler may no longer be used. Turbuhaler still contains some medicine, but it is no longer the proper quantity for inhalation. It is normal not to see a change in the window after a single dose. Keep Turbuhaler upright with the coloured grip downwards. The openings in Turbuhaler provide the flow of air during inhalation. Make sure not to cover them with your hand when you inhale. Turn the coloured grip as far as it will go in one direction and then turn it back again as far as it will go in the opposite direction. You will hear a click. 1 dose of medicine has now been loaded. Turbuhaler is now ready for use. Please note that there is no sense in clicking numerous times in succession because only 1 dose can be inhaled at a time. If you do click a couple of times in succession, the dose counter will count it as a used dose. The dose counter indicates that fewer inhalations remain than are actually available. Blow your nose. Then breathe out gently. Now close off a nostril with a finger and carefully insert the nose piece into your other nostril. Make sure that you keep your head upright and that the Turbuhaler is horizontal. Breathe in rapidly and as forcefully as possible. Before exhaling, remove the inhaler from your nose. You have now had 1 inhalation. Repeat these steps for the other nostril. If multiple doses are needed per nostril, the steps are repeated. You now receive the medicine, but you hardly taste anything. After use, turn the white protective cover on Turbuhaler so that it remains dry and clean. Make sure that Turbuhaler does not become wet when the protective cover has been removed. When you shake Turbuhaler, you will hear a sound. This is not the medication inside, but an agent that ensures that the medicine stays dry. Therefore, you will also hear a sound when Turbuhaler is empty. Turbuhaler may not be cleaned with water. However, you can clean Turbuhaler mouthpiece with a dry cloth or tissue. Store Turbuhaler in a dry place, preferably at room temperature. Inform your doctor if you take any other medicine in addition to Turbuhaler. Also inform your doctor if you are pregnant or breastfeeding. If you still have any questions about how to use Turbuhaler after reading these instructions, contact your GP. If you are unable to handle Turbuhaler grip due to illness such as rheumatism, the Handy Grip may offer a solution. The Handy Grip will help you to turn Turbuhaler grip more easily. You can receive the Handy Grip at home free of charge by sending us a request in writing or by email.